Good afternoon. Hongella, Christina. My name is SHO3. I'm going to talk about clinical presentation and complications of measles. So the clinical manifestation of measles, it depends on the stage. Measles has 4 stages. There's incubation, prodromal, the exanthem, and the recovery phase. So the clinical manifestation will depend with the time when the child will present to us. So the incubation period is about 6 to 21 days. Some literatures, they say it's about 7 to 14 days. So on average, it's about 14 days. So the first viremia is asymptomatic, because that's when a patient has the inoculation either via the respiratory tract or via the conjunctiva, and then after the replication, then the virus will get disseminated in the blood. So usually this stage is asymptomatic. Then the second viremia happens few days later, and then this one, somehow it coincides with the prodromal phase. And the prodromal phase lasts for about 2 to 4 days, which is characterized by the conjunctivitis, cough, coryza, fever, malaise, and anorexia. And significantly, during this phase of prodromal, the patient might have Koplik spots. So most of the times when we see these patients, because when they present to us, they already have the measles rash. So by the time the rash appears, these Koplik spots are not seen. Usually you can find them at the buccal cavity, next opposite to the molar tooth. So they are like grayish, whitish papules. Then the exanthem phase, it's about 2 to 4 days after the onset of fever, and a patient who is in this exanthem phase is infectious 4 days before the rash appears and 4 days after the rash appears, and also has other features like lymphadenopathy, high fevers, pharyngitis, non-purulent conjunctivitis, and splenomegaly. So clinical improvement after the rash has appeared occurs within 48 hours, and it can last up to 6 to 7 days, and it fades by the order that it appeared. And we know that measles rash is cephalocaudal fashion. And recovery and immunity. A cough can persist 1 to 2 weeks after measles, and if a patient presents with fever beyond 3 days of rash, then that's measles associated complication. And measles, the measles virus needs the measles infection needs both humoral and cellular immunity. First to clear the virus, but also to confer the lifelong protection. So the immunity after measles infection is lifelong. So that's why these children that are admitted, we do not immunize them, because once they get the infection, they already have their lifelong protection. And also still there are reports of reinfection from these patients, the patients that had a previous measles infection. So measles and immunity, measles virus can cause a transient suppression of T-cell responses. It affects both humoral and cellular immunity, but significantly it affects the T-cells, particularly the CD4s and the T helper 1 cells, and that's why we can get a delayed type hypersensitivity response to recall antigens when a patient has measles virus infection. And also the cellular and immune response to new antigens are restricted, and that's the reason why we get all these measles complications that you're going to see in a few slides that are coming. So the complications can be in more than one system, but the most common complication that these patients are presenting with, it's diarrhea. In some of the literatures that I was looking at, they were listing it to be at about 8% of patients with measles who present with diarrhea. Other things are gingival stomatitis, hepatitis like the case that has been presented here, mesenteric lymphadenitis, and appendicitis. Then in the respiratory system, the patients can present with pneumonia, croup, bronchiolitis, and bronchiectasis. Ocular, they can present with keratitis and corneal ulceration. This is the reason why these patients need to be given vitamin A drops. The neurologic complications can be subacute encephalitis, edema, and subacute sclerosing panencephalitis. All these neurologic complications are listed as the leading cause of morbidity in patients with measles. Then we can have rare cardiac complications, which is myocarditis and pericarditis. So specific for this patient that we have presented, acute hepatitis post-measles, literatures concerning measles in children, they are rare, but there are some few reports about post-measles, acute hepatitis post-measles infection in adults. So the prevalence is about 71% to 89% in adults and 4.8% in children. This study in children, it was done in Greece, and that's why they listed this, the prevalence of 4.8. So the risk factors of hepatitis post-measles infection, that was analyzed in the articles that I went through. They listed that the concurrent use of hepatotoxic drugs. So I thought this somehow tallies with the case that we have presented, because this patient first was, when the child fell sick, the mother took the child to different clinics, so we don't know which medications the child used. But significantly, the mother told us she was giving paracetamol. And when nothing worked, she used herbal. And we know paracetamol can cause liver toxicity. Herbal use causes liver toxicity. So we are thinking that the paracetamol use and the herbal use in this child, on top of the measles infection that he got, could have predisposed him to get the acute hepatitis. Then in the articles that I went through, in these patients, they did a biopsy, the immunohistochemical analysis and electron microscope, and they found measles virus in the hepatocyte. So that means the measles virus infected the liver. Then acute renal failure post-measles, I didn't find any pediatric data, but also there was unusual presentation in adults. And these adults, like I saw an article that presented 3 cases. All of them, they presented with renal failure and some neurologic involvement. And these 3 patients, 2 of them died, and 1 of them just recovered with a sequelae. And in the histopathology of the renal histopathology in these patients revealed the severe interstitial nephritis. This also implies that there was a direct invasion of the measles virus into the kidneys. So this one answers Dr. Jean's question when she asked about what caused the acute kidney injury in this patient. So we think also on top of this patient got the measles virus, so as a way of the immune suppression, the way the virus gets to attack every organ in the body, then the same way the liver was attacked, but then the liver was predisposed due to the use of hepatotoxic drugs. At the same time, the kidneys were also involved. So also, they mentioned that the measles virus was isolated in the urine of patients who are confirmed to have measles via their laboratory test. Thank you.